When I was little, I wanted to have a clinic where I would help people not get sick in the first place. I've always wanted to be a doctor.
It was kind of a nice blend of scientific knowledge, which I enjoyed, and people.
The ability to know your patients with time and see how their lives change and go through struggles with them.
I have the honor of taking care of people in all settings of their life. I'm the one who gets to tell them they're pregnant. I'm also the one who sometimes tells them they have cancer, but I get to do that with caring and compassion for them.
Our motivations may be individual, but we discover the rewards and challenges we face are shared.
I was offered a job at a few sort of corporate structures of medicine, and I knew that I would miss the intimacy of patient care and the ability to make my own medical decisions based on what made sense.
You don't see independent practitioners as much as you used to. Most every place has a label of some hospital organization on their door, and we don't.
Sometimes it seems as though our ideals struggle to survive the realities of business, bureaucracy, paperwork.
The biggest challenge is having to be everything, running a small business.
In the middle of seeing a patient, I realized something's not going to be covered, and I have to go talk to the biller and have the biller talk to the patient, and it's very tiring.
The hardest part is just the forms and paperwork that comes in, all kinds of forms. I hate forms.
There's a dichotomy in every physician of, I'm a professional, but I'm also having to be a business person. And often those two create friction.
And then we realize that these need not be impediments, but rather forces shaping a new set of tools to help us reach our goals.
The big epiphany was we went and visited a medical site, and they were using an electronic medical record, and they told us how they work from their paper charts into the electronic medical record, and we all said, okay, we can do this.
One of the challenges of being an independent physician is the amount of time that it takes to chart and chart well.
And it allows me to have flexibility. I don't have to stay tied to my office. Probably save me 2 hours a day of clinical work.
We see how improved efficiency, organization, workflow can help practices thrive and lead us back to where we started.
Being able to keep a consistent record where you can read handwriting and communicate clearly and efficiently with other physicians, it's priceless.
We decided to do it. We jumped in together, and it's worked.
We find our dreams remain intact, with a new freedom to do what doctors have always set out to do: care for their patients.
It's getting back to what primary care or family practice was intended to be, the place where people go for their central coordinated patient care.
I'm now seeing patients that I delivered and seeing them grow and their families and taking care of their kids.
There's just those special moments where you just feel like it's a win, you know? You get to know each other and they share a piece of themselves with you, and you know that it's going to lead to some difference in their life that's tangible.
The solution, then, is simple. We make the choice for better health.
You sort of feel that you're at the front lines and you're doing your duty and you're doing it well. And you're not going to leave. You're going to hold strong.